Assalamu alaikum students. Today I will tell you about the congestive heart failure. Its next of congestive heart failure, which includes the pharmacotherapy of the inotropic drugs, vasodilators, diuretics, aldosterone antagonists, and beta blockers. Okay. Drugs used in the heart failure are five types of drugs. Diuretics. The diuretics reduce the number of sacs on the wagon of the donkey. It lessens the weight of the heart. It lessens the weight of the heart. Okay. The diuretics involves the loop diuretics, which includes the furosemide and torsemide. The thiazide diuretics, which includes the hydrochlorothiazide. And the potassium sparing diuretics, which includes the spironolactone, also is aldosterone antagonist and the amiloride. Diuretics. The diuretic retain a central role in the pharmacological management of the congestive symptoms in the patient with heart failure. Their importance in heart failure management reflects the central role of the kidney in the hemodynamic, hormonal, and autonomic responses to cardiac failure. And the net effect of these responses is the retention of sodium and water and expansion of the extracellular fluid volume, allowing the heart to operate at higher end diastolic volumes and thereby to maintain left ventricular stroke volume. Diuretics. However, this increase in the end diastolic volume results in higher end diastolic filling pressures and the increased ventricular chamber dimensions and elevated wall stress. In turn, these changes result in pulmonary venous congestion and the peripheral edema, ultimately limiting further augmentation of cardiac output. Here is the mechanism of action, which includes the glomerulus, proximal convoluted tubule, in which the reabsorption and secretion of carbon secretion. There is a carbonic anhydrase inhibitor in the proximal convoluted tubule. It works on that portion, and the osmotic diuretic, while the loop diuretic works on the loop of Henle, which is the solution concentration. There is a sodium potassium perchloride pump. Okay. In the thiazide diuretic works in the distal convoluted tubule, and the aldosterone antagonist works on the collecting duct. ADH antagonist also works on the collecting duct. There is a mechanism of action in the afferent arteriole and the efferent arteriole. Loop diuretics. Of the loop diuretics currently available, following are the widely used. Number first is the furosemide, which is known by its brand name Lasix, and the bumetanide, which is the brand name is Zure in Pakistan. The thiazide diuretics. The thiazide diuretics are most frequently used in the treatment of systemic hypertension. These drugs have a more restricted role in the treatment of congestive heart failure. Potassium sparing diuretics. The potassium sparing diuretics act principally in the collecting duct of the nephron and either inhibit apical membrane, sodium conductance channels in the epithelial cells, for example, amiloride and triamterene, or act as the aldosterone antagonists, for example, canrenone, spironolactone, and eplerenone. These agents are relatively weak diuretics and therefore are not effective for volume reduction. Aldosterone antagonist. Aldosterone antagonists work by blocking the effects of a stress hormone called aldosterone, a substance which can make heart failure worsen. Multiple studies have shown that drugs that block the aldosterone have helped people with heart failure live longer and do better overall with less need for hospitalizations. One added advantage of taking aldosterone blockers is that they prevent the kidneys from getting rid of too much potassium while you are taking other stronger diuretics. Aldosterone antagonists includes the spironolactone. The addition of spironolactone to digitalis and on angiotensin converting enzyme inhibitor significantly improved survival among patients with chronic severe heart failure. Spironolactone competitively inhibits the binding of aldosterone to cytosolic mineralocorticoid receptors in the epithelial cells in the late distal tubule and collecting duct of the kidney. Mechanism of action of the spironolactone, whose brand name is Aldectone. Water in, water out research lab. Watch for the symptoms, which includes a headache, diarrhea, hyperkalemia, increased level of potassium, which is the increased level of potassium known as hyperkalemia, electrolyte imbalance, fatigue, and GI disturbance. Save the potassium, get rid of the water, blocks the aldosterone in the kidney, gets rid of the sodium and water but saves the potassium. You have to save the potassium in the spironolactone because spironolactone is a potassium sparing diuretic. Okay. Remember, too little or too much potassium will cause weakness in muscles, including the heart. Thank you so much.